Hi, now let's discuss about cancer screening and diagnosis. So what is cancer screening and why is it important? So, so we often hear that like early cancer so that like the patient can survive. So cancer that is found often very tiny, small, and in that case, we heard that sometimes it can be cured or treated easily. So the screening is finding the cells that do not yet show cancer, but that might turn into a cancer cells. So this is important because once we wait too long, it become a cancer, then it already means that it infiltrates growth and metastasize potential. So our point of screening is we don't need to find the cancer, but before it becomes a cancer. So that is called a pre-cancer. And our doctors often treat this because even if it's not a cancer, but pre-cancer, but it has a potential to become a cancer. So for various types of cancer, we can screen it. So I listed it here. So let's look at it one by one. So for example, breast cancer, X-ray mammogram can be used for a screening. And sometimes like that X-ray mammogram can become like three-dimensional tomography too. So colon cancer, stool testing for blood can be useful for finding out of colon cancer. And from the rectum to the descending colon, that shape very near to the rectum, the S shape is called a sigmoid colon. And to watch those with a rather short endoscope, it's called sigmoidoscopy. So that is also recommended for screening. And sometimes we can use some computed tomography, CT, to look at the shape of the colon and screen. So for that, sometimes we can use a barium enema. So barium is a heavy atom that X-ray, when you coat the gut with a barium by enema, then you take an X-ray or CT, then you can actually watch if the potential of a precancer is over there. And of course, the longer part of a ascending and this transverse and descending whole part of the colon, we have a colonoscopy to look at this, screen the colon cancer or colorectal cancer. And for cervix, for female, the cervical cancer can be screened so-called with a Pap smear. Pap smear is a smear near the cervix, the entrance of the cervix, and that part we look at the cell shape and we can screen for the presence of cervical cancer. Or directly watching the this part of the cervix, as we use a colposcopy by optical imaging, we can use it for cancer screening. For male, what about the prostate cancer? So there is a cancer biomarker for prostate cancer, which is called PSA, stands for prostate specific antigen test. However, this one, often the level will grow as the male gets older. So it's not really recommended a routine prostate screening around the age of 50. The problem is for male, at the age 80, then about 80% of that male have a prostate cancer. So it becomes a problem whether at that long, high age, and the typical prostate cancer growth is slow and not likely to metastasize. then there occurs this high level of PSA doesn't necessarily mean that this is a cancer. So this is serving as an indicator, but it's not very specific. So lung cancer, lung CT scan can be useful for finding lung cancer, but this CT also exposes some ionized radiation. So especially smokers, it is recommended for finding and screening for lung cancer. And ovarian cancer, also like prostate cancer, it has also blood test and or in ultrasound, although it's not very accurate. And so ovarian cancer screening is not very much recommended for women without family history of ovarian or breast cancer.